Elena, it is such a pleasure to have you. You and I both know that millions of women are suffering with migraines, probably suffering with a migraine today. And one of those women is me. I woke up with a migraine. And I remember usually I get up super early in the morning to go work out. And I woke up at 6 a.m. with a migraine. And I was like, maybe, and I know better. I know this isn't going to happen, but I was like, maybe I can sleep it off. Maybe in the next hour before my son wakes up, I can get in front of it. And obviously that did not happen, but at least I got a little bit of extra rest. And so I know that there are so many women, like myself, who are having to still function, having to still show up for work, show up for families in a lot of chronic pain. And I know that this has been your story too. And so I'd love to just really start off with what was kind of the inspiration of you wanting to support women. Gosh, I can't even imagine how many women. I know that about 78% of migraine sufferers are women. And a lot of those migraines there's an onset that starts around, I would say, in midlife, when hormones start to get erratic. But some women like you and me actually start to have migraines when they're little girls. So share with me kind of when your migraine started. I feel like it was around the same time mine had started.
First of all, thanks very much for having me again due to some technical issues. Yeah, so my story, it was personal as well. My story started around 14. I was given the contraceptive pill actually because I had hormone deficiency. I didn't have enough estrogen. My period was very infrequent. So my gynecologist at the time thought that was a great idea to just give me artificial hormones. I didn't make that connection in forever.
Yeah, and shut off your cycle.
Yeah, exactly. About half a year later, I started getting these terrible headaches, one-sided, nausea. I really couldn't function, light sensitivity, noise sensitivity. I really would wake up with them. So my parents at the time thought I was starting to be a difficult teenager and I was exaggerating, But eventually, I remember that very first really intense attack, waking up in the middle of the night, not knowing where to go with that pain, what's going on, trying to crawl to the bathroom. And I couldn't reach the painkillers and I just collapsed. And then my parents found me crying in the morning on the bath mat, basically. And that's where they started to take it seriously. But we went from doctor to doctor. They did brain scans. They saw that I had a tumor. Nobody could really tell me for about a year what's going on until Dr. Google was actually making the diagnosis first before any doctor then confirmed it. And then we figured out actually this migraine thing, my grandma had it as well. And it's over 1 billion people in the world that are in the same boat. So then we were starting to hope, well, if it's that frequent, right, surely medicine has figured this out. There's something we can do about it, right? And that could not be further from the truth. We tried everything, and you suffering this yourself from this yourself, that the options are fairly limited. We tried anticonvulsant drugs that led me to forget the name of my best friend and common words like different or donut. They were just gone for days. Kind of like dementia. I nearly burned the college dorm down actually being on pyramid. I put potatoes on the stove and I forgot that I was going to have lunch. And then I went for a run and I came back and literally everything was cold and everything smelled burned for weeks and everyone hated me. That was a time when I thought, okay, maybe pyramid isn't the answer either, very scary. So yeah, lots of trial and error, lots of attempts. And eventually I realized I was never going to lead a normal life anyway. So 20 days plus migraine a month, chronically affected. I could only take triptans and painkillers on 10 days a month because otherwise you become addicted and there's medication overuse headache and all sorts of problems that come with that. So 10 days out of 30, I was stuck in a dark room trying to survive, trying for the pain to pass. And so I went into neuroscience to eventually maybe at least contribute to our understanding. Because at the time, also, nobody could even tell me, what is a migraine? Why is it happening, right? But there were some theories, nothing really made sense. So I studied neuroscience, and towards the end of my degree, I was so lucky to just stumble across something procrastinating from my second master's thesis, which was the oldest therapy for epilepsy, which is a fasting mimicking diet. And when reading upon the mechanisms, all the puzzle pieces kind of fell together and everything made sense. At the time, I already thought, okay, so migraine is a warning signal. It's too common to be an accident of nature. It's too common to just be a mutation that doesn't have any purpose. If you think about 1 billion, every 7th person has migraine genetics. From an evolutionary perspective, it's very unlikely that these genetics, these set of different genes would have been passed on to this day and age if there wouldn't have been any advantage to it, right? So I see it as a warning signal. We need to figure out what it's warning us about. And I was thinking it's an energy deficit, at least. There's a lot of connections to energy metabolism. And I was doing a project on neuroimaging, and I remember one day the scanner broke down and one of our chronic migraine patients had to come back to be scanned again 2 weeks later. And she walks in a room and I almost didn't recognize her. She was walking upright, she was beaming. Anybody in like super chronic pain, you can kind of see it. She's lost weight, she was smiling. She was like a different person. And I asked her, like, what have you done? And she told me, well, I've been fasting for 2 weeks. And I thought that's so odd. Like, she hasn't eaten anything. How is her migraine gone? It doesn't make any sense, right? If the brain is reliant on glucose and sugar for fuel, how could this be possible? And so eventually we gave her a biscuit after the scan, and she had a migraine, that a very bad one, that same night. So we even triggered her migraine. And what I found out, and then I'll wrap up because I know I've been talking quite a long time, but basically what I then realized reading upon this epilepsy special in this study was that her brain, even though she had not been eating, had been fed for the first time, properly fed, because the brain can actually use more than just glucose for fuel. And just because we're eating excess calories doesn't mean that we actually have energy inside of the cell. So calories enough doesn't mean energy in the brain. And that was one of my biggest aha moments. Energy doesn't equal energy.
Well, and you're talking too about things like same type of situation for dementia, right?
Yeah,
Where it's a glucose metabolism issue. So even if you're consuming food, it doesn't mean that we're converting that energy over into brain energy due to insulin resistance or poor glucose metabolism.
So it doesn't mean that it gets there, or utilization. Exactly right. Exactly right. So her brain probably couldn't use glucose effectively, either transporting it into the brain or turning it into energy in the brain, as you said, in the mitochondria, the powerhouses. So basically, when she got into the state of ketosis, this fasting state, her liver made an alternative fuel source for her brain that was not glucose, but this small chain fatty acid called ketone body, which you might have heard of. Now, this could now finally, because it has a different transport system and it's a different way of being metabolized, could finally be turned into energy. And that's one thing I realized. And then reading upon the mechanisms, there's so many potentially migraine protective pathways involved, which is, we'll get to that later, or they're anti-inflammatory, they're antioxidants, they're more efficient energy source, and so on. They reduce hyperexcitability in the brain, which is important for migraine. So everything made kind of sense. Oxford said at the time, way too risky. There's like zero data on this, that any of this would work in migraine. So this is
there's data on ketone bodies and a more of a ketogenic diet for traumatic brain injury.
But this was like 10 plus years back,
right? Okay.
So there was very little data. So everything was just up and coming. There was epilepsy, period, pretty much. Maybe there was something else on. There was nothing for migraine, and they said, too risky, this could fail. Can't do that here. And so I left England and Oxford and went to this, how I ended up in Switzerland, in tiny Basel, in the 3-country corner between France and Germany. That's where I am today. And I did my PhD here. And it was the first ever clinical trial on exogenous ketone bodies in a randomized controlled patient trials. In migraine, but also in patients in general, using exogenous versions of these ketone bodies that your liver would make if you're fasting in migraine. And then that led to a first patent, some publications. And when I realized Big Pharma isn't going to do anything about this, I started a company. And now we just launched this in the US last year, a medical food for migraine, but maybe more on this potentially later. But for now, that's my story. Pain turned passion, first research, and then out of necessity, as nobody seems to be very interested in migraine at all ever, I also started a company to kind of bring this to other patients like me. So I'm down from 20 plus days to less than 1 a month. It hasn't all been the brain ritual, of course, the product. It has been the power of ketosis and micronutrients and antioxidants, but also quite a few lifestyle changes that we can maybe go into that I thought are important. But in any case, I have my brain back, and now hopefully the information we provide will help others to get their brain back also. And I just want to say that once you're a migrainer, you will always remain a migrainer. Your brain will always have that warning signal function, but hopefully we'll raise your threshold so high that the migraine only is needed very occasionally when you really know, okay, now I probably have done X, Y, Z wrong, or now it's warning me and forcing me to rest a bit, or it's alerting you to something else that is wrong in the body and that you can react basically to it.
Yeah. I mean, I think what we're looking at, I mean, the research again, and migraines are still, scant relative to the amount of people who suffer from them. And really all we're looking at is drugs, drugs
Yes.
to mitigate. And we can get into that in just a second and, what the drugs are really doing and what they're not doing. One of the things I want everyone to know is that migraines are a syndrome. The pain is just a part of it. There's multiple symptoms. And also another thing that we're looking at regarding migraines is that it's a part of an autoimmune condition potentially, right?
Can be related.
Yes, it can be.
Yeah.
And we're going to get into, as the warning sign, part of it, what we talked about last time was that it's really a warning sign of oxidative stress and a warning sign of inflammation. And it's interesting. I was thinking about your story and how irregular cycles, a lack of estrogen, and then they put you on synthetic hormones that are contraception that literally turn it off and you stop really making estradiol. Your brain's like, oh. And if estrogen,
it was like the worst.
Yeah. It's the master regulator for the brain and it drives, it is a huge regulator of glucose metabolism in the brain. And so I think one of the reasons why we see women really struggling in midlife or even right before their periods is when we're in a low estradiol state that inhibits, one of the mechanisms, I think it really inhibits glucose metabolism, right? Estradiol drives insulin sensitivity and it drives glucose metabolism in the brain. But when it's not there, and I think this is what's happening today for me, my period starts tomorrow or today, and I'm in a very, very low estradiol state. And this is usually, I'm down to just 1 or 2 migraines. Like, honestly, the last time we talked, I had a migraine too. What are the odds? I was like, this obviously, Elena, you're my trigger. You're my migraine trigger. No, I'm kidding. I'm
the common denominator. Oh God.
It just happened to be the timing of when we did these. Maybe I should look at my podcast scheduling around my cycle, right? That maybe, but and
that's actually a good idea.
Yeah. And we're going to get into the oxidative stress, but I know that for me, estradiol or low levels of estradiol, well, that hasn't always been the case. Obviously a little bit of background on me. I started getting migraines when I was 7. So before I had a cycle. Yeah. But that was due to, I had multiple head traumas and that drove my migraines. And the same as you, it was many days in the bed, dark room, because what 7-year-olds having migraines and why? And so this is back in 1986. Yeah, 1987. But gosh, it's so hard to articulate what you're going through at that age, right? Horrible stomach nausea. I had migraine with aura. And I was basically in a locked room for days and ultimately went down the rabbit hole just like you, brain scans, neurologists, chiropractors, acupuncturists, I mean, name it. And I'll never forget what one of my neurologists had told me was basically like, you're just going to be living with this for the rest of your life. Like, just saddle up, get ready to take medicine and take migraine medicine for the rest of your life. And as a result, I took so much Excedrin migraine growing up that I ended up developing a stomach ulcer because, I was just burning through my gut. And through lifestyle and a lot of changes I made in my 20s after college, I got them under control. But then they came back with a vengeance during my pregnancy when I was 41. I only had one every quarter for years. I would say over a decade. I would have told you I was cured of migraines for about a decade until I got pregnant. And it almost doesn't make any sense unless maybe it was inflammation or maybe my autoimmune got triggered. I don't exactly know, but I technically should have been, I know I was flushed with estrogen that's the whole point of pregnancy. You're flushed with estrogen. So that wasn't.
And typically people are feeling better, right?
Yeah,
so
usually migraines
I've
go
been,
away
I've been
during
thinking
pregnancy.
about this. This is quite an interesting phenomenon. What I've been thinking, just to touch upon this point quickly, is, well, you've been pregnant quite later in life. So this could firstly be stressful on the one hand, right? Oxidative stress is the common denominator. Estrogen typically is very protective. It's a very powerful antioxidant. But what I thought was possibly your estrogen receptors potentially have already been quite down-regulated because you're 41, could be, right? So that you maybe didn't have the receptors ready to receive all the estrogen that is now floating around in your system. So I think we see that a little bit with hormone replacement therapy. The ones that are not responding typically is when you give it too late stage. So you've already had a downregulation of the actual receptors where the estrogen should be working on, right? So possibly, maybe
I mean, I had enough to get pregnant, right? So during that time, I was on an autoimmune protocol. I was on a very strict autoimmune protocol. I was on a lot of things. I was on progesterone, to maintain the pregnancy. So there was a lot of things. I was on a lot of brain building supplements for building the brain of my baby. So yeah, it was really interesting that I was.
Maybe it was also some of that. I don't know what you were taking.
Know.
What did you take? Did you take alpha lipoic acid, for example, by any chance?
Gosh, I don't know if that was, I was definitely taking that for mitochondrial optimization prior to conception. Choline, B vitamins, omegas, vitamin D, vitamin C, probiotics, obviously a prenatal, Weenatal's prenatal, which is amazing. There were probably some other digestive enzymes, but there were some other brain related supplements. Most of them were high antioxidant driven supplements.
Alpha lipoic acid is a double-edged sword because alpha lipoic acid is also a chelating agent. And for some, including me, for example, it can mobilize more toxins than you can excrete. So alpha lipoic acid, even though it's an antioxidant, reduces a lot of oxidative stress indirectly in those that are toxic.
I don't recall that I was. And it's okay that we don't figure this out right now. And what has been the biggest driver of my migraines has been oxidative stress and inflammation. And we live in a very toxic world, and we're going to get into that in just a second. But where they really spiked again was when I had 2 back-to-back massive concussions and I had post-concussion syndrome. I had a litany of migraines, and I ended up spiking migraines for a year and a half. I had about 15 a month.
That's your brain screaming at you. Right?
Yeah. It's like, it was inflamed.
Oh my God, I'm dying. You got to do something. I have too much inflammation, oxygen.
Totally. Yeah. Lots of hyperbaric oxygen, lots of different things that I did, lots of brain recovery, supplementation, food, being in a ketogenic state.
This can help. Yes, at least the research says.
Yeah. And then doing a lot of brain treatments. I had a lot of different practitioners working with me. And so they're down to that was a year and a half ago or almost 2 years ago. And now they're down to just 1 or 2 a month. So that's in a lot of ways,
just 1 or 2 days a month of the menstruation, because I think many of our listeners will relate to this phenomenon. And I just want to say that we grew up in a world where every medical advice was kind of made for men. All research on drugs are made for men.
Until 1993. Yeah.
Everything was basically either male mice or rats or just male in general. And I think what we start to see now is that women are actually different. And what I even only am now kind of considering into my life is we need to have a clue and we need to know where we are in our cycle. And then our behavior needs to change. So before our period, this 1 to 2 days before, you say you have your menstruation coming on probably tomorrow, we're the most vulnerable because we have lost the protective shield of estrogen and progesterone because they're dropped very low during that time. So this is the time where we need to especially watch out. Don't have exhausting podcasts late at night or whatever. It's
late.
You need to really concentrate, right? Don't do any sort of fasting, right? Ideally, have excess calories during that time because your body will need it, right? You're not as insulin sensitive, so you'll be an inefficient fuel burner. Have excess sleep if you can, right? To kind of prevent. Maybe this is the time to take some exogenous ketones or extra minerals or whatever else you might be doing, antioxidants to be a bit more protective. This is the time to have your recovery days, to not do strenuous exercise, right? To take it easy, to not do extra hours of work. After your menstruation, leading up to ovulation, most likely you are going to be at your best. So this is where you can do the more stressful stuff and where you can maybe implement some fasting. So I really think where we are in our cycle really matters, and really checking that we are more in control of anything that raises oxidative stress during those really, really difficult or insecure days leading up to your period. And oxidative stress, we always think about stress, but oxidative stress, these free radicals that can damage your body, these kind of bombs that destroy anything they bump into, they can be created from physical stress, chemical stress, or psychological stress. And interestingly, inside of your body, it doesn't matter almost which one it is. It will look identical almost on a cellular level. So you really have to watch out for relationships, for saying no, for not being perfectionist, for maybe getting rid of toxic relationships or work stress that you don't have to have. Looking for chemical stressors. This could be in your hygiene products, in your cleaning products. This could be your air, your water, many things, like even your food being more contaminated, processed food, scent, perfumes. Perfumes are the new smoking.
Oh my gosh. Ugh.
We really have to watch out for perfumes.
Well, especially if you're a migraine sufferer. Like I was on a flight on our way home from Austin a couple days ago, and one of the flight attendants, such a sweet lady. Oh my God, she was drenched in perfume, and she was our lady. So she was constantly in our area. And I was just like, oh my gosh, like scent is such a trigger for me, like getting in a Lyft or an Uber. Like obviously we have no scent in our house at all, except for essential oils. And I'll get into these cars and I am like, I have canceled cars. I've gotten out of cars because I'm like, this is going to trigger a migraine.
And I bring a mask everywhere because I have no idea who's going to be in the tube next to me or, in the bus or wherever I have to go here in Switzerland, public transport. I always try to stay away as far away from people as I can due to somebody walks in and I'm like, oh my God, they just walk past.
Just everybody stay as far away from people as possible. No, I'm kidding. But we're talking about oxidative stress. You mentioned all these things. It's a lot of variables to control, right? The air that we're breathing, the water that we're drinking. But I think what's most important, what's most practical for a lot of us is, I think, becoming aware of our triggers.
I just want to say, coming back once for the sense quickly, so people understand, usually your brain is protected, right? So chemicals don't get in as easily. But in your nose, so you can smell, the blood-brain barrier is actually broken. So any toxin that comes through the air is literally having a no questions asked into
no
the
hold
brain.
bar is what I call it. Yeah.
Yes,
right straight into the olfactory.
It goes straight in there. And so that's also why, again, your migraine is warning you. If that's really aversive to you, it probably means you've already accumulated some oxidative stress and some toxins in your brain. So you're more sensitive. But it's really a warning sign. So I cannot stress this enough. Perfumes are non-regulated. Any kind of toxins can go in there because people think, oh, you're not eating it, who cares? 50% of perfumes have toxic substances where we know it's destroying your brain. So really, really watch out for that one. Just want to stress that again.
Perfumes are as toxic to me as cigarette smoke is. Like both are such big triggers for my brain. My brain.
And we have no power over it.
Yeah, right? Major alarm
spaces. You cannot do anything if somebody wears perfume, right? At least cigarette smoke is now banned. And I think hopefully eventually the same will happen to perfumes because it's not ethical. You don't have a choice if you were exposed or not, right?
Yeah.
And people don't know. So that's a bit of a problem.
Yeah.
But and you were in Austin. Were you at the health optimization?
Yes, I was. I was at the health optimization.
I would love to hear. After this, you have to tell me a bit about it. I wanted to go. Last time was in London. That was a bit more convenient for me.
For sure. Yeah. Right? It's usually in London. It was the first time. It was amazing. Especially when you leave, I live in a very healthy, beautiful, privileged bubble, very crunchy, very green, very healthy little beach town in northern San Diego.
North Diego.
Yeah, San Diego, called Encinitas. And then I go to other places where there's just not as much of awareness, around scents or around the water, just a lot of things. So you should see the amount of stuff we traveled with, for our family. It's insane. We had 3 checked bags plus our own car seat. And then we had 6 carry-ons, which meant because my son was with us, obviously. So we had just a
wow. So the whole family went.
Yeah, the whole bag. And we had all this. So obviously, once you're in the airport, you have to buy the plastic water. But we're so mindful about the water we're drinking and all the supplements we brought. Oh my gosh. We go to a grocery store once we get there to just, again, I was actually having this conversation with my son this morning over breakfast about brain foods and how we support our brain. He's 4. Yes, he's 4.
Right? Yeah. Oh, wow.
So we were talking about what brain foods he had on his plate. He had eggs, so choline and blueberries, and he had a little bit of other protein, and he had I make these amazing muffins for him from scratch that have tons of fiber. And so we're naming all the brain foods on his plate. Plus he had his little probiotic, that he takes in the morning. And so how we think about things, I always tell him, the way that I make breakfast, lunch, and dinner for us is I think what's going to fuel and support our future brain, and so, he's so cute. He can count to over 100, it's like 100, 200 or something like that. And he can do multiplications. And I was like, your little brain is just moving and grooving. And I was like, it's a lot of it is the brain foods that we're feeding our brains that help us to have really strong brains. And it was just so sweet. And that's just very much the way that we think about it, because I'm not only trying to grow a beautiful brain, but also how do we reduce the oxidative stress in the brain, with whether it's the air purifiers in the house or the water filter on the house. Even when it comes to his bath, I don't want chlorine or any of the whatever impurities that come into the water, because even that, when that's aerosolized, like hot shower water, I can smell the chlorine in water. When we were in Austin,
the US,
yeah,
yes, yes,
yeah.
yes. Yeah.
And so when, we were at the Austin hotel, it was like a chlorine shower. And that really spikes my brain. It sends immediate. And I know some people are listening to this and she's like, oh my gosh, this woman, she's doing too much. But I mean, my brain immediately signals to me stranger danger, with the wrong water, I'm highly sensitive. And so
Same
because
here.
of that,
And
yeah,
sometimes we also have to tell ourselves, 80-20. I mean, we can't, I know, and I'm the same. I step into that water in the US and I have to have a shower, right? So I'm like, oh my God, what's going to happen? But I think to reassure listeners, right, you don't have to do this 100% and perfectly. But if you do 80% right, and then you have some showers that are with chlorine or some food in the restaurant, you can't control it. If you then stress over it, right, then you create even more oxidative stress and it's worse. I think I also fall into the category that then easily I try to do it 100% perfect. But most probably, if you do it 80% of the time, you will be fine. And you can start slowly. Anything in the right direction is better than having processed foods and not worrying at all, right? And you can make conscious choices. And the most important thing is that you know what could be problematic, and then you can see how you can tweak it. So this is, as you said, right? If you have the luxury to get a filter in your house, amazing.
get it.
If you can only filter your drinking water, then you are 70% there, right? Do that. That's 70% better than drinking the tap water, right? So there will maybe might get through your skin, but you also have detox organs. So the skin is way less problematic than you have all your drinking water unfiltered, right? So opt for the things that you can control and that are in your budget. And eating real foods is going to bring you a long way, right? So I think that's where we all have to start. Like no processed foods. If you can afford organic, fantastic. If you cannot afford organic, soak the vegetables and fruits in baking soda.
Baking soda and water. Yep.
Baking soda and water, that's going to do something for sure. And then you can look at the Dirty Dozen and you can start peeling stuff. So that will also take you 70% there, 80% there, right? So there are ways. Go to your local butcher, choose the less fancy cuts of meat. Like I'm eating heart, I'm eating lung, I'm eating liver. You almost get that stuff for free because nobody wants it. And it's very nutritious, actually. You have to adapt your palate, right? But that's how you can get even like organic sources of meat that will not cost you a lot if you're a meat eater, right? And with supplements, the same. I mean, yes, high quality, yes, opt for the ones that you really need. And on the lifestyle front, yes, if you can purify your air in your room, perfect. But if not, maybe you need to just move to outside of the city, right? That's what I did. I can't afford like a super fancy place and a park inside of the city. So I'm just moving outside to the countryside. The prices are way cheaper. You have way better air. There's always an option usually to do things a little bit less high end and still get 70 or 80% there.
Okay. I love this. So first things first, I think is one to become aware of your triggers and when you're having your migraines. Are they connected to your cycle? Trying to get clear.
Yeah.
If you're like me,
exercise. Yes. Exercise, fasting, very common triggers that I didn't want it to be true because I think exercise is good for everyone. But really watch yourself. All common advice typically doesn't apply to all migraine patients. So
no, I know.
You always need to
know your
health advice. Exactly. And observe your body and then really allow the truth to show itself.
Yeah. And also, like you and I both, as we're highly sensitive, I know we're not the only ones. If you notice that fragrance is kind of lighting you up and you'll feel it, right? You kind of feel it I feel it always in the back of my neck in my occiput. It's kind of like what I call my Achilles heels. Yeah. There'll be a tell. And when your brain's, you can feel your brain is just not happy. It may not be a migraine. It just may be the brain's like, ooh, I don't love this. Whatever those things are, do your best to kind of mitigate around them as much as possible. So the second my brain is so good at telling me like, no, this is a full body no, like walk away or go somewhere else. And so I've removed it out of my life as much as I can control, right? As much as travel is where it gets a little tricky, but do the best you can there. And then we were talking about, obviously lifestyle intervention. I would say that probably the biggest needle mover for me, Elena, has been lifestyle interventions to help mitigate. But I'd love to talk a little bit. I know we're going to get into supplementation medication. The question I actually am going to have for you as well is with the ketone bodies. So I have a lot of ketone bodies here at the house, and I obviously I don't love the way they taste, but after listening to your conversation, I've been using them. But I'm curious, let's say, again, pretty consistently, I guess I always is every month. I'm like, maybe I won't have one this month. And then there it is. Ta-da! When it comes to, like, say today, I woke up and I was like, oh, there it is. There's the migraine. And she's hanging with me for the rest of the day, and I'll have what I call a migraine hangover tomorrow. And then hopefully that's the end of her until next month. But if I knew that potentially it was going to happen today or tomorrow, you're recommending it taking the ketone bodies yesterday? Or should I be like, once I know, I start taking them immediately? Because again, we don't know we're going to have them until we have them. Yes.
You know that the likelihood is 90% or whatever. So what we recommend, I mean, this is a little more than exogenous ketone bodies. And we know that people are using this in their period. Either they use one a day and then during and before the period, they double up.
Okay.
Or some even just take it during their period because you're adapted. So we have a bit more, and I don't always know if it's just the ketone bodies, right? So there's CoQ10, there's riboflavin, there's magnesium, there's trace minerals, there's antioxidants, there's a carnitine, there is magnesium and calcium, D-beta-hydroxybutyrate. So the D is important. That's the one that makes energy, actually, and a lot more in it. So that one-stop migraine cocktail basically seems to work even acutely. It's crazy. It wasn't designed like this, but we have patients sending us pictures of the ibuprofens they weren't taking because they've taken this, but at the very onset of the first attack. Now you're sleeping through it, which is why I think this would be better to take before.
As a preventative, let's say I am maybe 2 days prior to my period, knowing that it's probably going to happen, I should be taking those exogenous ketone bodies.
And the other thing is exogenous ketone body is a very broad category. I wouldn't recommend anybody to take ketone body esters because they are 50% alcohol. Butyl is an alcohol. So then you're kind of making things.
Now you're just making things worse. Now you're talking about oxidative stress.
Now you're talking about oxidative stress and stress on the liver, right? Yeah. So this is one thing we really took care of, even with the micronutrients. Everything is in a bioavailable, human identical version, meaning your liver doesn't have to process anything. It doesn't have to convert anything into an active form. Because we know in migraine, the liver isn't basically maybe even the number one organ before the brain, or at least the second important organ that is struggling because of all the medication overuse, the oxidative stress. So we don't want to put more stress on the liver. And that's what sometimes can happen with a strict ketogenic diet. I really struggled with that. I started with that and it was working for my brain, but the rest of my body felt awful because my liver needs to make the ketone bodies, and it was already struggling with everything. So
because you had been taking migraine medication for so long that your liver, had kind of, And I would think by the time, so many of us in midlife, as hormones are declining, our livers, what is becoming a big epidemic right now is non-alcoholic fatty liver disease. I mean, we're really seeing this. And so I always tell women, when it comes to hormones and overall reducing your oxidative load, you have to love your liver. And so I love that you've created a product that doesn't put more burden on the liver, because at the end of the day, a lot of these things have to go first pass through the liver and the gut.
And they call it metabolic liver disease now, I believe.
Yeah.
So it's been
it's a different name because that's what it is. It's not, it's not
exactly. So
finally metabolic. It's insulin resistance. I mean, let's call it what it is, bit more than anything. And what she's talking about, if not everyone's watching this on YouTube or watching the video, it's her supplement, Elena.
Brain Ritual.
Your Brain Ritual supplement. So I just wanted to point that out because we'll have a link in the show notes as well.
I'll get you some as well. So
totally.
You can try.
If you're listening to this and you're struggling with migraines, or somebody's having migraines, I mean, obviously a lot of the recommendations that we're making in terms of reducing the toxic load, reducing the oxidative load is going to be huge. And I mean, like me, I've got the Nurtec. I took Excedrin migraine today because I had too many meetings that were important. And I don't have Brain Ritual yet, but I'm like, who isn't at a place where you're willing to try anything? You're willing to do anything. And there's a lot of things that I am doing every day just to protect my brain. And yet it's not enough to be fully migraine free, at least not yet for me.
Yes, and you're doing everything. And I must say, it's not going to work for everyone. Nothing.
I know. Not everything works. Yes.
But unless you're allergic to any of the ingredients, right, it's not going to do you any harm. And worst case, you filled up your nutrient reserves, right, and you've added some ketone bodies. And that can already be a good thing for brain health in general, even if it may not do so much for your migraine. So thanks a lot for the shout out. I mean, worth trying. I'd love to hear.
Worth trying. I mean, I think for any of us who are suffering like this, what is it? The third most, brain disability.
Most common.
Yeah, most common disability that you can have.
The second disabler, actually, and the first disabler among women.
Yeah.
Under 50.
It's and it's awful. I mean, I always say I don't ever wish migraines on my worst enemy. I don't ever want any woman to be
and you now have children, and I'm asking myself the same question. Can I even have children? What if, I mean, you have a boy now, that's good. I think that's somewhat protective, right?
Yeah, thank God.
Yeah, exactly.
Yeah. Well, but also
that's the worry, right? You think totally. Like, what if my children would have it? Like, is it even ethical to?
Well, even with my Hashimoto's, I was like, oh, thank God I'm having a boy. Like, the risk for Hashis is significantly lower for him, the risk of migraine. I mean, and this was the thing when I was getting pregnant, I took a whole year to prep up for my pregnancy because I knew I was older. I already had oxidative stress. Like I knew I had migraines. Those had been under control, but I had an autoimmune condition. And there was just, I was like being mindful, like, okay, what can I do to really stack the deck in his favor? I didn't know it was a boy or a girl at the time, but all of that was on my mind. But even today, like, just trying to get him ready this morning and to be with kindness and gentleness and just having loving energy for him. And it's so much harder when you're in a state of chronic pain and your brain feels like it's going to explode, and so.
But then, children are sensitive. And I think if we bring them up with perfection, it may also not get them ready for life, which is never perfect. So I think if you occasionally are suffering and he feels it and he sees it, I think it's okay.
Yeah, I think it's okay. Talk about like mama's brain. I'm mindful. I'm really careful, about how often is mom's brain broken, and so we're mindful, but I still like, it's interesting. The reason why I say that is I just want to send lots of extra love to all the ladies listening with migraines who are still having to navigate family dynamics, take care of their kids and show up for work and just try to.
So much admiration. And you can be so proud of yourself. I mean, what you're going through, very few people will ever understand. And what you're still doing is just so incredibly brave. The amount of people with chronic pain that are doing everything they're doing, it's insane, really. And it's such an achievement that you all should be so extra proud of and really forgive yourself. And I really think your children will not suffer greatly if they do see some of your adversity, and it will make them stronger later in life and appreciate the small things. I'm sure of it. So don't blame yourself if you can't be perfect all the time. You're doing the best, and it's incredible, really.
Elena, one more question I have for you, because I think we may not have touched upon it enough. What have been some of the most powerful interventions? Obviously, we talked about brain ritual specifically due to your PhD background, but anything else that maybe people just don't know that they can be controlling in their world?
Yeah, absolutely. Mm-hmm. So what I developed is a 4-pillar model on how to master migraine metabolism, right? And that kind of led in the end to this, which is touching upon all 4 mechanisms or pillars, but you can absolutely tackle the pillars if you do it perfectly without any products other than food. So the first one is keeping blood sugar stable.
Yes.
That's essential. And that is because the brain is depending on the rest of the body to supply it with energy at all times, because it's surrounded by the skull. It's very hard, so it can't really store energy very well. There's no space for fat storage, right? Then it's protected by the blood-brain barrier. We already talked about this. So only a few selected small molecules can make it into the brain. So it's very selective in what it can eat. And this is glucose, lactate, only around during exercise, really, and then these ketone bodies. And then the other thing is the brain is super small, but it needs 20 to 25% of our energy needs every single day or night, whether we sleep or are awake, right? So it's very energy hungry. So in a migraine patient, oftentimes you have problems with insulin response. So that means if you eat a lot of carbohydrates and sugars, your blood sugar is going to rise up very highly. Then your body's a bit sluggish. It's realize, there's sugar. We have to send insulin to get the sugar inside of the cells. But the insulin comes delayed, and then too much insulin is released.
Yeah.
And that means
that we have hyperinsulin. Yeah, hyperinsulinemia.
Hyperinsulinemia and hypoglycemia. Reactive hypoglycemia, meaning now our sugar is lower than baseline. So now we're craving sugary fatty foods again because it's an emergency situation.
I call this the blood sugar roller coaster.
Exactly. And it's like a broken thermostat. You're either too hot or too cold. It's not good, right? And whenever you're hypoglycemic, your brain actually suffers because it's not getting a constant sugar supply. So that's why uncontrolled diabetes, in the sense of high blood sugar, for a time can even be protective. But you want the blood sugar to be stable. How do you do that? At least a whole foods, low glycemic index diet, meaning getting rid of all processed sugars and carbs and processed fats, and anti-inflammatory diets. Doesn't mean you have to get rid of all carbohydrates, but only eat the healthy ones. Also means controlling your sleep, getting enough sleep, because otherwise your blood sugar goes up. This would include infections. Infections are stressful. They get the blood sugar up if you have latent infections. This also means controlling your allergies. Interestingly, if you're allergic to a food, your blood sugar will be much higher as well. So these are just some things that are in this first pillar. Second pillar is micronutrients. Now, very few people know that in order to actually make energy out of the fats, carbs, or protein, like the macronutrients, you need coenzymes to help make energy, cofactors.
Mm-hmm.
Cofactors are the trace minerals, the vitamins, a lot of the stuff that's in here, but that's
the brain ritual supplement. Yeah,
exactly, the brain ritual supplement, but a lot of stuff that is actually not even contained in our soils anymore. So if it's not in the soil, it doesn't make it into the food, so we can be deprived of that. Magnesium, so many people are magnesium efficient, but who's heard of manganese, molybdenum, boron, chromium? Also important, but very many people have a lack in these, right? A deficiency in these. And the second pillar also includes supplementation, not only of micronutrients, but also of hormones. So this would be the supplement. We also need not only cofactors, but we also need certain hormones to turn food into energy. And this would be your thyroid hormone. Mm-hmm. This would be estrogen, progesterone, all of these, even potentially melatonin. All of these need to be in physiological ranges. That means too much is not good and too little is not good. And this would come back to your pregnancy example. Most people during pregnancy, because these female hormones can be protective, have a reduction in migraine frequency. But when things are too much for the body, even too much of a good thing, again, turns against us. So the same with glucose. You need glucose in a certain range and then it's good. Too much glucose is bad because it raises oxidative stress. Too little glucose is also bad. And the same goes for a lot of different categories. So bioidentical hormone replacement or bioidentical nutrient replacement belongs to pillar 2. Pillar 3 is then all around this oxidative stress category, which we've touched upon quite a bit already. So this means you need to reduce your oxidative stress load while increasing your antioxidant capacity, which is basically the capacity to neutralize these bombs. And oxidative stress is also the number one factor of aging. It's involved in all chronic diseases. So it's really in your best interest across categories, not just for migraine, to keep this at bay. And this is now removing toxins on all 3 levels: physical, psychological, chemical. Mm-hmm. And on the other hand, we have the antioxidants. For example, sulfurous vegetables have a thiol group. Thiol groups are very good for catching free radicals or detoxing toxins. Toxins removal, safe toxin removal, is one of the most complicated and most relevant issues of today's time. This would fill a whole nother podcast or 3 or 4. That's a whole nother topic that if you think you are toxic, you have to look at. One thing you can do very safely is look at your detox genetics of the phase 2 liver detox pathway. If you have mutated enzymes here in today's world, you'll probably have an issue. And this would be the glutathione S transferases, GST-M1, T1, P1, and NAT2, N-acetyl, I'm trying to say it in English, sorry, N-acetylcystase or something like this too. That's another phase 2 liver enzyme. And then we have SLE2, superoxide dismutase 2, yes. Also important. And if these are, for me, 2 GSTs are mutated, NAT is mutated, and SLE2 is very little functional. So that's like the disaster for today's world. So yes, I have had to excrete toxins to even survive, and for years. Not everybody will be there, but that's all category 2. If you fall into that camp, you have to do high-dose melatonin potentially, which is a very strong antioxidant that can get inside of a mitochondria. This will be also for you. If you know your period is coming, really taking increased dose of melatonin, and then see how you're doing, especially if you have the migraine, wake up with it. This was going to give you an extra protection during the night, hopefully.
And talk about, Dr. Elena, what are we talking about high dose? What would be a high dose if you think your migraine's coming, if you get them at night, you wake up with them in the morning, what would be a preventative dosage for that?
So if I have a migraine coming, I take up to 50 or 60 milligrams, so super high. And that's, I don't want to recommend that to anybody without asking the doctor, whatever. I'm not a medical doctor. Nothing is medical advice. It's just my experience here that I'm sharing, or any scientific knowledge. But yeah, so if you change anything, please talk to your medical professional. But melatonin, the beauty is you can fairly dose safely, work your way up. So I wouldn't recommend start with 50 milligrams off at the bat and you've never taken it before. Start with 3 to 5. See how you feel. Now, generally with melatonin, once you get nightmares or you feel very hangover in the morning, it's a good sign it's too much. Like, I always tell the story of my dad at Christmas. It's quite a funny one. So my mom is a mitochondria. She also has bad mitochondria. And I have it from her, and my grandma did, right? This is always inherited from the mother's side. And this is where the migraine genetics come from. And I was with my parents over Christmas, and I take like 30 milligrams of melatonin, and my mom gets about 10 milligrams. And I have this raw powder that I put in a glass of water, and I was dissolving that and leaving that on the table. And halfway through the Christmas dinner, my dad's like, "Oh my God, I'm so tired. I don't know what's happening. I'm so tired. I cannot keep my eyes open anymore. I have to go to bed." So he was missing Christmas dinner. He had to go to bed, and we realized that he's drank my mom's glass of melatonin. It was only 10 milligrams, but it knocked him out completely. And he's kind of the healthy one in the family, right? And he has very good oxidative stress genetics. He can handle all of that. To him, that's like way too high because his endogenous melatonin levels are optimal. He doesn't need it, right? My mom needs 10 milligram. I sometimes need 30 plus, right? It's very individual. You'll feel it. When I take melatonin, typically I sleep less, because my sleep is more refreshing, right? Because I have more oxidative, so your body detoxes during the night, your liver is working. If I have more melatonin, I have a bit more protection, and I feel a bit less groggy in the morning, although mornings are my worst always. So if you know, so I have 2 recipes for acute migraine versus prevention. Acute, I always say, so in the morning, during the day, right, when you don't want to sleep, I choose acutely. I choose caffeine usually because that gets up cortisol, mobilizes fat stores. Caffeine, magnesium, minerals, salt, half a teaspoon, quarter to half a teaspoon, ketone bodies. And if you know this isn't enough, an aspirin or benign painkiller at the very first onset, some people do not even then need the aspirin. They pour one sachet of this brain ritual migraine medical food that contains all of this apart from the caffeine, because you can take it in the evening as well. In the evening, you swap the caffeine with melatonin. If you have an attack oncoming, whatever you tolerate, doses of melatonin can really help offset some of the bad stuff.
Yeah, I have obviously melatonin here at the house. And it's so funny, the things you forget. And so I'll be taking it tonight. But when I was recovering from my brain injury, I was on 10 to 20 milligrams a night. And those were, again, having the migraines.
How was it feeling? How was it feeling? Wait.
I mean, the brain, gosh, it was such a dark time. Yeah, it was so hard to say. I was so committed to my protocols, but it took over a year to fully recover. I mean, I turned a corner within the first 3 months because I was like, it is committing or it's not getting my brain back. But also, and then we had mold right after that. And so
oh God.
And I was on high dose melatonin for mold too. And the reason why I want to point that out is that, as you just mentioned, I just want to validate that melatonin is a very powerful antioxidant and is a precursor to mitochondrial function as well. And so,
yes,
again,
completely underutilized.
You know, work with your practitioner, your health provider. Obviously, a functional doctor is going to be better at kind of navigating that than your typical primary medical doctor. I don't know if they know the research, but again, especially if you're dealing, again, we're talking about people with acute migraines, acute, oxidative stress in the brain and inflammation. Whatever we can do to kind of mitigate that inflammation is a win. It's so funny how when I was on these protocols, melatonin was an everyday thing. And then as I got better, it became less of one. And so I'm like, it's right there. And so tonight I'll be taking it. And I'm very safe.
If you're still tolerated or if you feel groggy.
Well, 10 is great, 10 to 20. So I'll be playing with 10 to 20 tonight and see how I do tomorrow. But yeah, just a beautiful reminder. And like Dr. Elena said, kind of titrate it up. Start with the 3 to 5. I find most people are fine with even up to 5. But again, when we're talking about mitigating massive inflammation in the brain, see where you can go. And again,
the crazy thing is, I'm not even sure if I'm supposed to say this here, but I've had a friend with glioblastoma, which is one of the most aggressive brain tumors. And even ketosis didn't help her at all. High dose melatonin her tumor is gone. It sounds crazy, but she's still alive and nobody was expecting her to live.
That's incredible.
It's a very powerful substance, underutilized, in my opinion, because it's always a risk-benefit analysis. And I feel like the risk with melatonin, apart from maybe long-term shifting estrogen, potentially a little bit, because hormones always interact with each other.
Yeah, they're not in a
So
silo.
if you want to get pregnant, maybe highest dose melatonin every night isn't the best idea long term because it could influence your estrogen levels. But otherwise, in an adult who's chronically inflamed and has oxidative stress, which has negative consequences, right? So
Significant.
Exactly. So then
Migraines, I feel being like the tip of the iceberg. I mean, we're talking if, always my thought is, gosh, and I don't mean to put this fear out there, but I'm like, oh, if I've struggled with this many migraines and they're a signal of oxidative stress and inflammation in the brain, what's coming? It just like, how do I, again, as you said, it's a signal. It's a warning, in a big warning. I always imagine like being on a ship and just like, like.
And there's a lot of comorbidities with migraine.
Exactly.
For a reason, right? So depression is twice as likely to be depressed, twice as likely to have autoimmunity, a thyroid problem, any kind of mental health problem, diabetes, like other metabolic diseases. Everything goes up because the common denominator is a malfunctioning metabolism to a very large degree. It's this inflammatory state.
Plus, I think we have an uptick in migraines is because it at its core, at its center, is metabolic dysfunction and insulin resistance. Again, we're talking about energy metabolism here.
The term I'm trying to coin is metabolic migraine. So I think we have metabolic Alzheimer's, probably have metabolic depression, we have metabolic migraine, and all of these in their root causes are fairly similar. So modern medicine always tried to isolate these symptoms and say, okay, it's a migraine and this we have to treat completely different to this depressed patient, whatever.
To this diabetes.
To this diabetes, but some of the root causes are so similar and he can solve so much with lifestyle changes. And I want to say, especially since I am now a CEO, but I'm always a patient first and a scientist second and an entrepreneur third. I want to say that even the best product cannot outdo unhealthy lifestyle lifestyle decisions or a lifestyle issue. So you always have to fix your lifestyle, not to 100%, because I know we're all human and we still need to live and you still need to enjoy a night out without feeling super guilty. That's also not healthy, right? But to a large extent, we cannot have an unhealthy lifestyle and expect to be good. No pill, no powder, no whatever. We'll be able to...
No HRT.
No HRT, exactly. We'll be able to undo all the bad things, right? So one step at a time in the right direction, fueling your brain, taking assistance from bioidentical hormone substances where needed.
I mean, I'm a full body yes to HRT, but I don't want everyone to think that it's the magic bullet. And I will
say, there's no magic bullet. We've got to put the work in, and
you've got to be a
incredible amount of work in.
Yes,
which is
and I think that's the blessing. So I want to have a mindset shift. I will tell you, when I'm in a migraine today, one of those days. Ooh, I'm just like, my ego comes in and is like, why is this happening to me? Why I'm doing all the things in the world, and goodness gracious, like, migraines, and so we can get into that spiral, especially if you're struggling with them, multiple times a month. I get it. Believe me, up until this year, for a year and a half, I was averaging 15 a month. I got to a point where I was like, no one should live like this.
Absolutely.
But
been there too.
Yeah, exactly. You're just like, there has to be a better way. Like people can't live like this. And so we've been there. And I always think of it as a gift. It's a beautiful gift for me to be as healthy as humanly possible.
When I get a migraine, I'm also always so grateful. I'm like, oh my God, this is how bad it was, like, and worse, and every single day. And now I have a reminder that all of these days I wake up and I'm not in a pain like this is a beautiful day.
Oh, it's beautiful. Yeah, no, what a blessing.
So this is that I get. It really makes you humble, makes you appreciate life, makes you appreciate the small things. And I think listeners will appreciate, once you've been sick, you look at the world differently. I know these people that have been healthy and everything was given to them their whole life, they're the worst people, right? They take everything for granted and it's not really forming their personality either. I think some of the most beautiful people I've ever met have gone through hardship. So it is something to be grateful for as well, because you appreciate the world more. You make better decisions because you know what really matters in life, right? So that's something that any listener who's had some health problems, it sucks and there are answers and we've given you a lot of stuff to work on, but also maybe take some time to appreciate that it probably made you a better human.
I love that. Yeah, as I've been sitting here listening and just loving this conversation, I have been in so much pain. And there have been moments in this conversation as I've been listening,
God, I can
thinking,
see it in your neck,
how
right?
am I going to get through the day? Like my brain feels like it's going to explode right now. And I'm,
Oh God, you need to rest.
it's okay. It's because I got I've got a light on me, right? In all the things, to make the podcast look a certain way. And I'm going to,
I mean, you look beautiful,
today.
even if you are in pain.
Yeah. I mean, I was like,
crazy how you do it, but
at least let me look good, while suffering over here.
yeah.
But the reason why I'm sharing that is that, again, I want anyone who's listening to this right now, if you've got migraines, I get it. We get it. Both of us, both Elena and I understand. As I sit here right now, I so deeply know your pain. I so deeply know that you're just trying to function and do the best you can. And yet your brain feels like it's on fire. It feels like someone's taken an ice pick to your eye. I get it.
And you're probably hiding it well.
And you're trying to hide it as well as you can. Yeah, I've got I couldn't even eat today. My nausea was so bad and so far. And it is what it is. Like we still show up. And if there's someone in your life that it may not even be you, but gosh knows, with as many women who are suffering with these as possible, someone in your life that is struggling right now who's got migraines. And I'm just asking of you to share this interview, to share this episode, to do them that big favor.
Sharing is caring.
Yeah, because there's so much in here today that at the very least, letting them know that they're not alone. As I'm having this conversation with Elena and I'm having such a hard time today, in these days, it can feel so isolating and it can feel so lonely because I don't have a lot of friends. And thank goodness I don't have a lot of friends with migraines. But on these days where I feel so sick and my brain is barely functioning, I feel like literally someone scrambled my brain. The fact that I'm like, am I even asking the right questions? Like I always doubt myself. I'm like, is anything coming out of my mouth?
It's incredible. It's really incredible.
This whole interview, I feel like there's been an ice pick in my eye. And I thought, what a blessing that I get to have this conversation with Elena today in the middle of this, where it's always at its worst in the morning. It'll get better over the day for me. But I just want women to know that they're not alone, even in that time where they're in that pain and they just feel so alone and isolated. And it feels so shameful because they don't feel like they're showing up the way that they want. I get it. And so please take a moment and share the episode with someone that you love. Or if it's you, I just want you to know that we are with you. We're standing with you. And I hope that there's something that you can glean from this interview today that helps you move yourself in the right direction so that you're not suffering in silence. So I wanted to say that. Yeah,
exactly. And when I was younger, I wrote a poem about the life behind the blinds, about all the things that we miss having migraine.
So much, let's be honest.
And miss so much
the sleepovers. I miss school. I miss going out with friends. Like I didn't do any of it. School trips, all of it canceled,
Yes. And I know that whoever's listening and who has migraine themselves, they're not alone. And the good news is it's never too late. There's not a time in your life where you say you've had migraine for 20 years, now you can't do anything about it. You're the perfect example. You've had migraine since you were 7, and now you're down to 1 day a month. It's incredible. It is
and it has been a ride, you guys. There's been years where I've been almost completely migraine free. And then there's been years where I thought they'd never come back and I had 15 a month, like literally 2024 was that year. So it can be
so sharing is caring.
Yeah.
And I wish I would have known like 2 decades ago what I know now. So yes, please don't let people suffer through loneliness and not knowing anything about their condition and why things are happening and what they can do. Hopefully this interview will help them regain some control. This was a lot of information. If you want, there's a free YouTube course where I go through the 4 pillars that we just mentioned, where I explain what is insulin, a lot of the words we were just using today and not going into much detail. Don't worry, we have you covered. Metabolism, mitochondria.
No, my ladies, let me tell you, they know about insulin resistance and
neural
functions. Yeah, this is the show. If they're
perfect. So you know all the words.
But still, I'm so grateful that you've got this beautiful program or course that they can go and check out on YouTube. I'll have the link there. And then where else, Elena? One, I want a link for Brain Ritual. So please hook me up.
We'll give your followers a discount as well, so they can try. Absolutely. We need to send you some as well. So you
Hook
can
me
try.
Up, girl. Hook me up.
Yes, for sure. This conversation made me want to build a community. When I hear about all the stuff that you're packing and preparing, it would be so much easier if you had like-minded people close by. Like nobody in my neighborhood knows anything I'm doing. The kind of stuff that you describe is exactly what I would be doing, but here I'm the alien, So It would be so cool to have a community where this just becomes standard, where we just have clean food and clean air and clean water, and nobody is kind of like opposing or thinking you're a freak just because you take care of your health or you don't wear perfume or whatever. It would be a dream come true to have like a community or a village that is something like that. And I guess Health Optimization Summit probably was a little like that.
Yeah.
People would understand what you're doing.
Absolutely. And I just want, we never know what someone's going through. We never know what someone's suffering with, and it's so easy for us to judge, to be like, oh my gosh, look at how, how crunchy she is, or look at all the things she's doing. That's so extra. That's too much. And you just don't know. You don't know why that person, because it is a lot to do all those things. And some of us, it's a non-negotiable if we want to function in the world. And so
exactly. And they don't see that all of this extra is just enough to function. Exactly. Yeah. That is, we do more if we can. And maybe one day, we can see, I don't know what you have done. One of the things that helped me quite a bit recently is after the heavy metal chelation stuff, which can only detox the heavy metals, is actually apheresis. So blood cleaning has been doing quite a good job for me, very bad detoxing genetics and so on, right? That's something else that even if you control your lifestyle perfectly, you might have still accumulated a lot of toxins over the years that your body needs some help with. That's the last pillar that is actually a really big pillar that we don't have time to touch upon today, but that's something that also is worth examining with a specialist, is really toxic load and whether this is destroying your mitochondria, getting your ATP levels in your mitochondria tested, your oxidative stress tested, if you have the means, testing your micronutrients in the blood as well, in full blood, not in plasma, please, your minerals and so on, and really seeing where you're at. And that will then really help you determine the path forward as well for your migraine management.
Yeah, agreed. Like I think about the daily things, like I use bean minerals, which is fulvic and humic acid. I put them in my son's water. I take magnesium every day. There's so many supplements that I'm taking as well. Very similar, probably very similar to the cachet, your supplement that's just all in one. It's multiple supplements. I'm in the sauna. I'm doing hyperbaric oxygen. Obviously, all the lifestyle interventions that we talked about today. Like I wear an estradiol patch right before my cycle to try to control those. And I'm still figuring that out, and for some women that works really great. For me, it's still not really working, but I'm mitigating some of my other symptoms as well. As my brain, some of again, estradiol being the master regulator of the brain, but some of us are more highly sensitive than others. It really helps me to mitigate other symptoms. Haven't seemed to get the one big, what I call the sit your butt down migraine, the big mamma jamma. It's the one I've got today. Because I've got like a hormone migraines, and then I've had the kind of the sprinkle. They have different flavors, and for anyone who's had them, you kind of know, your flavors. It's crazy that we can have different kinds of migraines, but this is my worst one. And like I said, it's only 1 or 2 a month at this point, which I just cannot tell you how grateful I am. But there's all these things that I'm doing to help mitigate. But at the end of the day, there's a lot of other brain symptoms that I'm also mitigating. Migraine being the biggest mamma jamma, I guess I could say, but the brain fog, the lack of stress tolerance, the mood swings, the irritability, the lack of alertness and word recall, like all of that has been improved as well, even in perimenopause, because of all the things that I'm doing. And, like you and I and so many women listening to this, our brain is one of our greatest resources, right? And, I was telling my little boy today that, my brain is everything. I'm able to ask these questions. I'm able to write a book. I'm able to show up. I have a big webinar tonight on fixing women's metabolism. I better show up. I'm going through a lot of brain research in this webinar tonight, and I'm spending the rest of the day prepping that webinar. But if I don't have a brain that's functioning and working, I can't do these things. And so, I think about all the things that I do to mitigate even the minor symptoms of brain inflammation. And then I've got the big migraine kind of symptoms. And so the point I'm trying to make in that is that, there's a lot of things that we can be doing daily that can reduce that toxic load, that can really ease and reduce our inflammatory process of the brain. And I think for women in midlife, that really becomes mission critical. And there's a lot that we can do every day to mitigate that. I want you to know that, it's not impossible to manage, and it can be done relatively inexpensively.
Yes, a lot of it doesn't cost much. Some of it costs a bit more, but wherever you are,
yes, it depends.
Wherever you are, there's a lot you can do, right? There's so much you can do. We didn't even get into a whole psychology of things as well, because
we didn't talk about trauma.
trauma, stress, guilt from having the migraine, like all of these things can also elevate oxidative stress. So really what I try to preach is loving yourself for all the things that you can still do, that your body is still doing for you despite all these migraine and despite of whatever fire is burning in your body, inflammation, being proud of your body, loving your body despite the migraine, in a way, loving your migraine for trying to warn you and trying to listen to your body more, what it's telling you, and then being an ally with your body and not trying to fight against it, even that's really hard because it does feel terrible, right?
Yeah.
But
it feels like a betrayal.
It feels like a betrayal, but actually it's your brain.
It's a warning
to
sign.
help you. Yes, it's your brain trying to protect you from whatever is going on, right?
Yeah.
Being your own detective. And really, that's the sad truth, taking your health into your own hands, because sadly, there's very few doctors like Dr. Mariza out there that will really know anything about migraine or metabolism or brain health from a more holistic perspective. So yeah, really trying to be your own advocates and taking it with help of your doctors, maybe guiding them, but also taking things in your control. Because if you wait for somebody else to fix it,
I always say
may
there's
not happen, right?
coming to save you. No one is coming to save me. Even my best doctors, they've got drugs. It's what they've got. And some of the lifestyle things that we talked about, the sleep, the stress, the things that manage our metabolic health as well. But ultimately, that's what they have. And so if you're looking for a more holistic protocol, literally, this is why I wanted you on the show today, is to talk about, okay, what can we really do to move the needle? What can we do to get out of this pain? What can we do to work with our body, to be an ally with our body, to mitigate these symptoms and to mitigate this disabling, chronic condition that many of us are struggling with?
That makes me realize we didn't cover pillar 4. We didn't actually.
Okay, one more.
We stopped at pillar 3. Pillar 3 was.
I got so excited about pillar 3.
One of the most important ones, actually. This is where we introduced this alternative energy source for the brain that for many, many people has really been making profound changes once you have the other pillars covered. And that's where you can introduce ketone bodies, either via a ketogenic diet. If your liver tolerates it, it makes you feel good. Really here, measuring is key. Measure, make, measure is what we say in German. You wouldn't say make, you would say do.
Yeah, you would
right?
measure. Yeah.
You measure, you
test, don't guess.
Measure again. Yes, that's the English term, right? So that's something you should really be trying to see. Are you actually in ketosis? Right. There's finger prick tests for your blood that you can use. And that's really something that I would advocate here, either diet or, if that's too hard, a high quality exogenous ketone body version. I would prefer not the ester for the reasons of the butanediol, because that's hard on your liver again, right? So experimenting with that can make a huge difference, because it could be that your brain is not very good with using glucose. It will always need glucose, right? Don't get me wrong. 40%, 30 to 40% of the brain's energy needs always must come from glucose, but that means we can replace 60 to 70% with something else, which is quite incredible.
Well, and it becomes important. I just want to, migraines aside, as we move through perimenopause into menopause, with 66% of all dementia and Alzheimer's patients being women, a lot of it has to do with glucose metabolism in the brain and it becoming impaired due to a lack. What we're seeing is a lack of estradiol, right? The brain, what I call the brain fuel, the brain regulator, as it declines, which is going to happen in perimenopause, we see this uptick in insulin, in relative insulin resistance in the brain.
And it can be completely isolated from the rest of the body. You can be insulin sensitive in the body, you don't even see it. And the beauty of the ketone bodies is that they're insulin independent. So even inside of the brain, right, you have these they're called GLUT transporters.
Yes.
And they're responsible for taking in glucose into the cells. Some areas like the blood-brain barrier, it doesn't need insulin, but the neurons and the astrocytes actually need the insulin to shuttle the glucose inside of the neurons. So if you don't have insulin sensitivity in the brain, your neurons are literally starving.
Yeah.
And ketone bodies use MCT transporters. So monocarboxyl transporters, completely different transport system. So you have some way to completely circumnavigate the problem. It's like there's a congestion here and we're just using a completely different highway.
I love that.
And we're driving around the issue. And that's why also, yes, keeping ketone body metabolism or ketone body something that your body knows what it is, right? So having that around, gene expression changes, your body's like, oh yeah, we know what to do with that. It's probably a good idea also for aging, as you said.
And I say, one of the easiest ways to do that is to maintain metabolic flexibility, right?
Yeah.
However,
It sounds easy and
yes,
it's really
not as bad. I know.
It's not easy.
It's literally what I'm covering tonight. It's how do you maintain metabolic flexibility? Because it becomes, honestly, it becomes a non-negotiable as we move into midlife and into the second half of our lives. But easier said than done, especially with only 8% of American adults with good metabolic health. And so we definitely have an issue where we don't have metabolic flexibility. And so we got to come up with other creative ways, like you talked about, of feeding the brain other substrates, ketone bodies, to actually fuel the brain.
That can be the crutch as well, right? So that can bridge you over, because what we realize is that even with exogenous sources of ketone bodies, your body does adapt to a point. I mean, it sees the molecule, and some of the changes are actually happening even if you're not on a very strict ketogenic diet, but that can help you get some flexibility back to be able to then transition into longer periods of fasting or lower carb periods where you have less glucose or carbohydrates present. Now, what is really hard is if you go from a super high carb processed diet immediately overnight to ketogenic state, that will, for me, that was triggering like the worst period of migraines ever, right? If you do something super drastic, it will be very hard on your brain and on your body. So this can also help transitioning you into a more lower carb state here and there, so you become more metabolically flexible, and also to have the electrolytes and nutrients as a buffer for that transition does make things a little easier. Because I always say you probably have decades where you've destroyed metabolic flexibility or your brain health, right? You can't fix that overnight, and we can't expect that to be fixed overnight. So that's going to take some time and some patience. So sometimes we can use some crutches, at least, I think.
Yeah, I agree. I mean, gosh, it's a whole nother conversation to get into that, but I feel like we touched upon it today a couple of times. And yeah, it's something to be on everyone's radar, every woman's radar, as we move through midlife, of like, how do we support metabolic flexibility? There's a lot of avenues to do so. And yeah, a lot of women don't do well on a ketogenic diet, migraine sufferers today specifically.
But still, they're females, right? Mainly females. I mean, there's some guys out there that might do very well on a ketogenic diet long term, but I also see that in females over time, thyroid levels go down, maybe they miss their period, it is not a natural state to be in forever. Like even the northern cultures, right? The Inuits, they would have summertime where they would still eat berries and whatever, right? So even them would not be in a ketogenic state forever. So more like seasonally.
Seasonally, yeah. Well, Elena, honey, thank you so much for coming on and for your extra grace and patience today with me.
Oh, I didn't need any patience. To me, it was noticeable. If you can ask these smart questions when you're in a full-blown migraine, then I don't know what it's like when you don't have a migraine. So it was great. I didn't notice a thing. Thank you for doing this despite having a full-blown migraine. It's had huge respect. I mean, honestly, also you can be so proud of what you are achieving and how you're carrying this with so much grace. Thanks, and I do hope that you get some rest before you
see how it goes. I know, but here's the thing. I mean, I think this is the reality for so many women who they can't cancel their day. They can't call out for work, so
you have to survive. And if you take painkillers on a couple of days a month, right, it will be okay. It's fine.
I just keep loving up my liver.
And you can support it.
Yes, exactly. I get lots of extra love to the liver over here, especially with the Excedrin migraine today. Okay, my love. Well, thank you so much for coming. And I'll have all the links in the show notes. We'll have the course. We'll have the brain ritual link with the discount code. We will have the website. Anywhere else you want us to find you?
We can add some social media links if you want, because that's also like more bite-sized content on migraine, typically, sometimes on brain health, some interesting topics like iron and migraine. What should you watch out with iron supplements, or some random topics like this that for some could be helpful. That would be on social media.
Perfect. Perfect.
We can talk about building a migraine community later on.
Yes. Well, I'm going to start
a village,
a perimenopause community pretty soon. And I know there'll be a lot of a facet of that community that'll be migraines as well. But yes, and I know I've been thinking about that. Gosh, there's so many women with migraines that are really suffering. But yeah, I mean, Elena, I do. If you decide you want to start a community, I will be there. So let me know.
Maybe I'll be in San Diego instead. It's so beautiful. Send me some pictures. I'll move over.
Yes, please.
Although the Swiss mountains are beautiful, contender as well. All right. Well, this has been amazing. Thank you so much.
Thank you, honey.
And hopefully talk to you soon.
Okay. Thank you so much for watching. Now, if you found this video helpful, give it a thumbs up and share your thoughts in the comments. And if you are ready to learn more about perimenopause and how to navigate with a lot of ease and grace, be sure to subscribe to this channel so that you can join our community. Don't forget to share this video with someone that you love, that you know is navigating the perimenopause journey as well, because they deserve to feel their best too. See you in the next video.